vibrators. So
Hey.
those red people,
Yeah.
the vibrator will be on. They will be on. The vibrator, we see smoke coming. Smoke will be coming out from the vibrator. This one will be still doing
They overused it.
Level 1, then G. Okay, financial level 2. Take us to level 2 vibration.
Some people put it at level 5, then sleep.
Hey!
Right. They say perception is everything. I don't know if you agree with me on this. Let me share this remarkable story with you before we go into today's podcast. There was a book I read from Mr. Femi Otedola, Making It Big. And he shared this remarkable story, which I find a bit interesting and fascinating. He said, in 1996, he met this guy and he was supposed to meet him up for a business contract, an assessment actually. So he came. The guy showed up in his house in a Jetta Volkswagen, looking at the amount that the contract is weighing. And the guy coming in with that type of vehicle, he looked him down instantly, beat down the price from 956,000 to 500,000. He was the man for the job, actually. He could deliver. But how he showed up brought him down instant. Then he told him that when you're coming in for such a contract as huge as this, coming in with this type of vehicle, a Jetta, I can't give you this money. You don't look deserving of the money. So you see that sometimes how you portray yourself, how you show up is everything. I don't know if my pundits will agree with me on this.
Yes, of course.
Amankwa,
You
have you had any experience like that before?
Me, I pull up, you see me too. See how I package, you know me now.
I know.
Huh.
I know. I want you to give me a typical scenario because I find it so interesting and it's been happening, especially here in Ghana. You know, Nigerians are so good with their game.
Yeah. Yes.
They will show up. Dog, you are nodding. Amankwa is not giving me what I want to hear. Share an experience with me.
Yeah.
Have you had anything like that in your life? Have you seen anything like that?
Mine wasn't a business contract though.
Okay.
I think it was one of the weekends that I was working and I happened to have this security man with me. So we're having a conversation. And then this client also came. And then he joined us. We were all having a conversation. We were laughing about it. And then later, not knowing he was coming for consultation.
Okay.
So later when I entered into the consulting room and then he also came up. So when he saw me, he was like, were you the one that we were having a conversation with outside there?
What's this?
I said, yes. I said, hey, but you are very, very simple, man. Because it never occurred to me that
you look
you
simple.
Are the medical officer.
He was expecting something.
Yes, like with some kind of tie and then
some coats,
some
big,
coats, yes.
huge thing. I said, we Ghanaians, we are fond of that too.
Yes.
Is it because of our lifestyle? It's like you find everything simple and easy going.
Yeah.
I'm not saying we should portray fake life. No, that is not it. But I mean, looking at this story I just gave out, meeting someone of such a caliber, a billionaire, saying this to someone who, I mean, like a growing or coming up person, he is even buying the idea, say, look what you are coming in for. You get it? Onukrana will be biabi.
Yeah. You see, for me, how I understand this whole thing is you have to package yourself well.
Yes.
It doesn't matter how little your idea is, but somebody can buy your idea in a huge price depending on how you address your idea.
Exactly.
Like, let's say I can pick a stone, okay? And I'll go to the market and I'll say, I'm selling this stone for 100 cedis. And people look at me and say, this guy, is he mad? But I'll take that same stone. I'll not sell it there. I'll travel all the way to, let's say, US or maybe one of these European countries. I'll give this stone to them. And I'll tell them that I got this stone from my grandma. The first thing that they'll think of is, if the stone is coming from my grandma, that means it's precious.
Definitely.
So the price now increases.
Exactly.
You understand? But if I would have sold it here in Ghana, the price will still be the same.
It's an antique.
So packaging is good.
Exactly.
Yeah, packaging is good.
Very, very good.
Yeah.
The best. Sometimes they can call you that come for movie. We go and settle down. You talk about the movie conference. You go, you pull up. They increase the price.
Straight up.
You have to pull up.
Straight up.
Well, is it?
Share your experience. I want you to share your experience. Share it with me.
So,
You see, when you are working, they will pay you different.
Oh, yeah.
Producers in Ghana.
Exactly.
Yes.
Yeah.
When you pull up, then they look at you, then go back door. They say, for increase the thing, because this one will be
You know,
small
go take it, you know,
man.
go take it.
No,
That be the
not
thing.
at all.
So packaging is everything.
It's
It
everything.
happened to me before too.
You see?
It happened to me.
See that one?
There was this upcoming actor, but the guy was, well doing. You understand? The guy got money, so he pulled up with a car and all that. So we there on the set. We are, we are actors. Like not like we are now coming to show our talent. We've already proven ourselves that we are okay. We qualify for this job. Now, comparing how I was treated
To him.
I was like, hey, I don't understand what is going on.
You see?
Because they actually gave him a first-class hotel. But we are supposed to sleep with each other in the room.
wow.
2, 3, 3.
Yeah. And I
You don't have a car,
didn't
you think you are
blame
important.
anybody for that.
So just because you don't come with a vehicle.
Yes.
It's because they are scared. They are scared that maybe the guy is too big. If you offer him something little like that, he might deny the job and go. But for you, dear, Master, you are looking for help. Master, we are helping
But
you.
Nigerians don't joke with that too.
Yes.
You see, Shatabando came here and he said something. Or say when he's coming, he will give you his demands.
Thank you very much.
And you will go by it.
Of course,
Yes.
it's random.
Yes. Shatabando. I say, oh no, Beka chose on here military men, on here police,
Yes.
on here
It's
security.
random.
About
You see,
5 people.
Those things are worrying
And
us a
they'll
lot.
put it there for him before he gets there.
It's worrying us a
Yes.
lot.
It's
I'm not gonna lie.
mindset.
I think Ghanaians, we are so laid back.
No,
And yet,
we are scared.
Not
we are
lay back.
scared.
They will
Are you
think
sure?
we are
See, we are
pompous
scared.
or something.
We are very, very scared. You know why we are scared?
No.
Because let's say I'm coming for a job from you, yeah? If I come and I start demanding for certain things, you might say, this guy is too no, papa.
Then you
Let me
will
use this guy and take this job.
That
But
is
I need the
Ghanaians.
job.
Yes.
I need it. And I feel like my life depends on this job. So I'm not ready to lose this job.
You have to go
Even if you tell me to lie down right now, I'm going to just go flat on the floor just for you to give me that job. But that is not how it goes around. You shouldn't do that.
No.
You should come with your package. Even if you lose it, it's okay.
Yes.
Then
They'll
you
remember
lose
you.
a lot of
Exactly.
things too.
Oh, you
No.
lose a lot.
Yeah,
I'm not going to
but
lie.
you
You
can-
in
you
Ghana
Policy,
here-
I'm telling you.
Well,
you
yes,
lose.
but you can't get everything too.
Yes.
In this life, you can't get everything.
Yes,
You must be ready to sacrifice something.
Something.
You don't go
Something-
below the belt. You
No.
set your belt.
You
there.
understand.
Yes, yeah.
So now you put yourself on that pedestal.
Yeah.
You are coming, you are meeting
You do,
me
yes.
at my place or where I want to be, not you coming to propose to me. In as
Yeah.
much as I need what you're giving me, doesn't mean that I have to lay down low for you.
No.
Too much.
Yeah.
I feel like Ghanaians, we
do that
excuse
a
me,
lot,
yeah,
yeah.
exactly.
that a
Maybe,
lot.
We
and
are
then you'll
too
be like,
humble.
and people see it as showing off or being too extra.
Yeah.
Do you get it?
Yeah.
See it as
But,
arrogant.
Kind
the
of.
situation of this man that was going for a contract.
Mm-hmm.
I mean, he went in with what
A
he-
Volkswagen
what he
Jetta.
has. So are we saying that in certain situation you have to go out and rent car?
You see.
out
Hey,
and
you
then
have to.
You have to.
Yes, I think you
Okay.
have to.
You know,
I
to
think
me,
you
what
have
Doc
to.
is saying to make sense. You see, if
So
you're
wait,
hungry, let them know you are hungry.
No.
So they will help you. That be that thing.
Because I've seen the same story too, where the person
Said-
actually was trying to play big. He lost the job and then he's now back in the
And
ghetto.
then you don't believe in yourself.
No.
That is when confidence steps in. Look, Shatabando
You don't
sitting
have
here
to be
that day.
overconfident too.
Please, Shatta has how many wives?
Which one?
Which one?
They dash am.
Shatabando.
They dash am the wife.
Shatabando has wives.
3 wives. Are you
wives.
surprised?
They dash am.
Wives.
I'm telling you, he spoke something here that I will never forget.
They dash am.
Or see, or no dear, his confidence level is high.
Wow.
Yes.
Oh, yeah.
So if Shatabando can give you his demands and you have no choice than to go with it, why can't you do so?
Everybody can do it.
Can.
Everybody
That's
can
why
do
I'm
it.
trying to shift the scenario from us
Everybody
looking
can
at
do
it
it.
as fake life.
Me, I see the
Me,
problem.
I don't see it as fake life though.
See, the problem is coming from the big men. You see, the producers and whoever that is giving you the offer. The problem comes from those people. So let's say I come for what we call it, an interview, and Amankwatu is coming for the same thing. So when I came, I'm well dressed, I have my car and all that. But looking at Amankwa's certificate and mine, we can say Amankwa is doing better than me.
Exactly.
But you know what? The moment we get there, they are not going to respect Amankwa. They will respect me.
Because you're well dressed.
Because, yes, to them, I'm doing well.
Already.
But, yes, but to him, they see him
think
as
I'm
somebody who
suffering.
need help.
Yes.
He's begging.
So they will
No, but at
receive
least
that
then
thing.
your certificate can speak for you.
Yeah,
In such cases.
exactly.
Okay.
But in Ghana, it doesn't work like that.
Yeah. A similar thing happened today. We interviewed some couple of staff for an account option, and one of the guy who was having a good certificate from Legon, even the way he entered in, then the approach as if someone who is scared.
You
And
see?
then, so I'm like,
Looking
this guy
timid
is
and
too timid.
tensed.
In my head, I was saying it. This guy is too timid.
Ukra
I don't like such a person.
You
And this
see?
lady also came in who is having an HND.
Okay.
And the way she was going about it.
Okay.
I mean, most of the questions she couldn't answer though. But I feel like, this lady, we can train her.
A boosting.
Yeah.
So sometimes your confidence to count.
You
Yes.
see what I was saying?
Confidence to count.
And
Yes,
you know, show up, go up. What you can do, I'm not saying, say, you know, who needs kakra, go and carry heavy metals, be and look like one of or 2 4 I say to 2 name Bani B. No, please, me pamucho and
Favoritism 2 days. Yesterday, I'm still thinking about it. Favoritism day.
No,
You see, Ghana people.
See, I have been in
No.
I've been in a bank
Uh-huh.
where I met this lady that I was in the same class with.
Okay.
Yo, she don't know nothing.
But she's there.
I say the girl can't even spell her name to save her life. But I saw her in the bank. She was one of them. I was like, are you coming for money?
It's
She
not
was like, oh, no.
confidential.
I work here. I was like,
How?
you took it off.
you work? Like, what? You clean or? Is that? Oh, no, Tony.
I'm quite
I'm
sure.
actually. So I was confused.
That
but
one is not confidential.
she looked
She
good.
used something to
she
get
looked good.
that
I was about to go there. She looked good. You
Yes.
see, she looked good.
Yeah,
So something is also helping. Something else.
It's
helps.
not just confident. You go with your car. The woman will come with no car, but they go employ the woman, leave you.
She got the car at the back now.
Doctor, you know that thing?
Doctor,
It's self car at the back.
you, the doctor knows what. He doesn't know anything.
Sure, doctor, cute though. Say woman, come this side. Then the man will be suffering.
Go that side.
Now, who bear my do yeah then? Wearing knickerbocker and says, go and sit down.
Men
With
will
your
suffer
CM
in this
pop.
world, though. Men.
Kakana
We will suffer. I don't know why. Men will suffer. Yeah. Women are choosing men. Men are choosing women. Hey,
Exactly.
women are choosing women.
Men
are choosing women. So where do we stand?
Some of them muni stand. Muni baby. Let's go into today's conversation. Today we have another interesting segment. We're yet to delve into it, and then let's see how it goes. I have a doctor with me in the studio, medical practitioner, who is on top of his game. I want to theme it a time with Dr. Jude. Let's see how it goes today. We're talking sexual transmitted diseases. We want to delve into this and, bring out some of the nitty-gritties that is not too out there. There are certain issues that are sensitive, such as these ones. And then we'll also talk about how the usage of sex toys can also bring about spread of these things. Doctor is with me in the studio. Dr. Jude.
Danso.
Jude, did I get your name right?
No, Danso.
You are Danso.
Yes.
Kindly look into your camera and tell my viewers who you actually are.
Okay, Dr. Danso from Minute Medical and Fertility Hospital.
Okay.
I'm the CEO of Minute Medical and Fertility Hospital.
Okay.
I'm a businessman as well.
Thank you.
Yeah, so.
What do you do?
Okay, so basically I handle the fertility programs and then surrogacy as well.
Okay, that's nice.
We do international surrogacy.
That's nice. Great. I think people will come fertility there. You have a lot of people trooping in your office after this.
Yeah.
You can leave your contact when we're done. So
Right.
I mean, this is a very sensitive issue as well. We'll talk about that one later. We'll find a whole day for that. It's something that is touching to me. I feel like I have a few people around me who are facing that problem.
Fertility issues.
Very important. Okay, so let's go into this. We're not going to take much time today. We want to know, when we talk about sexually transmitted diseases, Doc, break it down for us. What is sexually transmitted disease?
Okay, so sexually transmitted diseases are basically diseases that we attract from unprotected sex.
Okay.
I mean, when you are having unprotected sex with an infected person, then you attract these
Such
infections.
diseases. And these infections, what really falls under the umbrella of sexually transmitted diseases? What are some of the diseases that falls under this?
Okay, so we have what we call chlamydia. We have bacterial vaginosis.
Okay.
We have syphilis.
These are the popular ones that you are mentioning.
Yes.
Yes.
We have syphilis. We have gonorrhea.
Okay.
We have what we call herpes simplex.
Okay.
Yes.
That herpes is something that people don't really know about. For chlamydia, for gonorrhea, for syphilis, we all have heard it severally. But we'll go into that. But let's take herpes first. I don't know if I got it right.
Yeah.
Tell us a bit about it. How do you get it? How does it come about? And how are you able to identify if this is herpes?
Okay, so herpes is a viral infection.
Okay.
Yes, and you, contract it through sexual intercourse. That's unprotected sexual intercourse.
Okay.
And then mostly the symptoms that comes with it is clouded rashes at the genital area.
Okay. If you're a man, around
the penis, yeah.
The how do you call it? The head and
the head of the penis.
Hey, dog, why are you sugarcoating things? Hey, don't say. I really Look, this is 18.
How do you say it? How do you say
Rated
it?
18.
Which
so
one?
please,
You
today
say it.
you will hear everything.
What is math?
Math, no? I know that. You understand? No.
That is the
BA, so you get it.
The ring
Let me position my this thing well today, dear. We are so excited. Hey,
The questions I'm going to have for you here.
I'm quite super excited. Onyati penis na drink na ya
will be
oh church them so dog, let's go.
So basically,
That's
not
the cork, and I can't say.
yes. Not only that side.
Okay.
It can affect around the scrotum and then
Oh boy, that's bad.
the pelvic area as well. You can have these rashes, which sometimes is itchy,
Okay.
and then it is easy to burst, and which comes with this pain. And it can
Okay.
also form an ulcer at the genital area.
Ulcer.
Yes,
Oh,
ulcer at the
boy.
genital area. So what it is that with herpes simplex, there is no cure for it.
Oh my God.
Yes.
There's no cure.
Yes, there is no cure.
The virus
There are-
is no
Yeah, sure.
cure.
Yeah, there are medications that you can take.
Suppress it.
Yeah, to suppress it and the symptoms.
Both male and female,
yes,
no
both
cure.
male and
So
female.
that means it's more like HIV.
not
really.
Not severe.
not
like
severe like
yeah,
HIV. So normally when your immune system comes down,
Yeah.
for instance, when you should take treatment now, it goes off. You don't have the symptoms again. You are good to go. But when your immune system comes down, then the symptoms start showing up again, which means you have to go over and take the treatment again.
So it's manageable with treatment.
Yes, manageable with treatment.
So if someone has this infection or has gotten this infection before, and then after treatment, everything goes away. Maybe your immune system is not down, like you're saying. It's active. Do you have a chance, or is there a possibility of this reoccurring after full treatment?
It can take years without any symptoms.
Ooh.
Yes.
But definitely it will show up.
Yes, it will show up, as I'm saying, when the immune system goes down.
Wow.
Yeah, so it can be a year that you are not seeing any symptoms, you are okay. But then immediately you stress up, you do some activities that brings your immune system down, then the symptoms will
show up again.
Now, Doc, sorry to catch you.
No, don't worry.
In our African tradition, we have something they said, you see, when you fall sick, you see some rashes around and they say, thank you. And they call it, they say when you see a ghost or when you see something which no, but that is what they used to say.
Anyway, I've heard
that
before. I don't know if
is
it's
it true
myth,
or
though.
that one thing is herpes?
Yeah, we call it herpes zoster. Zoster. Yeah.
Okay,
so that one there is not transmitted like any sexual transmitted disease.
It's also a viral infection.
But how do you get it?
Okay, so that one is through airborne or maybe body contact.
Okay.
Yes.
So it's so that means that when
some
someone
allergies too can do
Yes.
that.
Well, I used to get that in a lot too. When I was a kid. Oh
Maybe
yeah.
your own part.
This side.
Allergy.
You go itch me straight.
So it could be a different symptom that you're having. Yeah.
Yes, maybe it wouldn't be that.
No.
So but that one, when it comes on or when it appears on your lip, how is it as severe as it appears on your genitals?
No.
Yeah.
So within your lips, we have what we call stomatitis.
Okay.
Yes, that can also affect that is a bacterial infection, not a viral infection.
Okay.
Okay, that's good. So now, looking at you explained how it looks like on a male, if it appears on a male. Let's go to females.
So the females normally it appears within the vagina and also
within.
Yes, within.
Jeez.
Around the vulva.
They can have it around the vulva, the vulva majora or the minora. Yeah, but then they can also have it in the vagina as
inside.
Well. Yes.
Doc, this is serious.
Yeah, this is serious.
Inside. I don't get it. No, wait. Where the baby comes out from?
Yes.
So how will you know that something is there?
Yeah, you're going to feel some pains. Okay, some pains like a burning sensation and a pain in the vagina. So that will alert you that, let me check and see.
If there is something like
let me check one more time. Then you check again.
Check and then
that's what I don't know. That's what I want to find out.
Usually, the women, when they go into the washroom, they know what they want to bring out from that area.
Why? Insertion is not good when
insertion
you're cleaning.
Is not good. I mean, we keep talking about it, but then it keeps going on.
Oh, but dog, say it's cleaning there. Our mothers, for great grandmothers and all of that, that's what they've been doing.
Yes.
So why is it that now, no say it's not good?
Okay, so your hand is not that hygienic. And then also we have what we call normal flora in the vagina.
Okay.
This normal flora protects the lumen of the vagina. So when you keep on using this Dettol soaps and all this concoction cleaning, trying to always clean the place, then you are taking off all this normal flora from the vagina, meaning you be prone to an infection.
An infection.
Yes.
I think the mothers have been saying this. I've heard
Yes,
it
but
before.
I mean, doing away with all these antiseptics you are saying and soaps, scented stuff.
You can use a normal water for cleanup, but then, I mean, you don't
still
push your hands.
Hey, what
that
if you are
far.
just doing around? Because imagine, okay, let's say you have this herpes, there inside, and then the thing is itching. Yes, how will you? You have to insert at least let it go inside kakra.
And that is why you need to visit the
Doctor.
hospital and then see a doctor.
Doc, this question is actually killing me. So let's say you have you are infected with this kind of virus, which is the herpes, right? And as a guy, I meet a girl with this virus. What would be the symptoms for me to know
that this person,
to find out say this person is an infected person?
Please, doctor, answer the
Doctor
question.
said
Let him answer because
Does
we
it
are
come
not.
with odor? Does it come with some rashes that the person might see? Does it come with any signs in the face? Like, is there anything that you can
Physically on your body before
Yeah.
going there? Is that what you mean?
Yeah.
So,
Okay.
I mean, I don't think any guy would put a lady down, examine the lady before
Entering
Yeah,
something.
entering something. And if these rashes that we are talking about will be showing in their faces or at
their
on
body.
part of their body, then it will be easy for you to detect. And then the odor that you are talking about, I mean, there's
Does
this
it come
heavy
with-
perfumes and all those things that.
Also, it does come with
Odor.
also odor.
No,
Okay.
Okay.
no. It's most of the vaginal discharges that comes with this foul smell.
Yeah.
It's
But
just
in-
the discharge that
the
will make you.
discharge.
the color will change.
Good. The discharge is when we talk about the discharge, that is where most of the issues comes out from.
Okay.
Yeah, because then we need to identify what is normal vaginal discharges and then abnormal.
Okay.
Yeah, because most of the ladies see any discharge as candidiasis,
Exactly.
what they call white. But we have a whole lot.
So this particular one, what are some of the colors? Is it plain
With
the
regards to
herpes?
no,
with the
it does not come with a
discharge?
discharge.
No
Okay, herpes
discharge.
doesn't come with a
No.
discharge.
Oh, okay.
What about the watts? They have
Genital
one.
warts.
Yeah.
Yeah, genital warts is bad.
Is it in the same family?
Yeah.
Yes, but then genital wart is different from
The herpes.
The herpes.
Exactly.
so genital warts. It comes out as a growth, as a growth. So wherever
I
it
saw a
finds
photo of
itself,
it.
Like
So it's
cauliflower
spread
something.
something.
good. Cauliflower.
So that
Hey.
one, no.
Oh God.
I don't got me a doctor. You don't know I'm a
No,
doctor.
this one is experience. This one
They have
this one is
similarities.
experience.
But
Oh,
that
God, I'm
one,
scared
Oh,
of
but
you.
even if
It
it's
grows
experience, I mean,
inside.
it's real talk. I mean,
When
I
it
know.
goes
if
inside,
you've
it looks
experienced
like
it before,
cauliflower.
you
That's what I'm
share
saying.
it.
Yeah, it's serious.
You've
Yeah.
experienced it. Was it
one?
painful?
No, I'm not a woman.
No, but does it affect only women?
No. It
No.
affects men as well.
Thank
and
you.
Then
Oh my Jesus.
when you are not fortunate and it happens within the urethra, then it means it's going to block your urine.
Track.
So
Yeah,
that
it's
is more
right.
severe than the herpes. Is that what you're
Yeah,
saying?
that is more
Yeah, more
severe than the
severe.
herpes.
Yeah.
Yes.
But I was thinking the herpes is rather severe because looking at the herpes, that one it grows from within.
Yeah, this one can also grow from within.
The
Flower
growth.
ni-
Yes, it can cover the whole orifice of
Well,
the
it's
vagina.
dangerous.
I think I saw some lady
Yeah.
like that. No,
Yeah,
but that one was
this
on the
is scary.
surface.
You
Yeah.
don't know.
It
This is
grows
scary.
like
Yeah.
It will be
Something.
like flowers on
think,
there.
and then flowers.
Blood.
I'm a summer government hospital. That was last 2 years.
Uh-huh.
Yes, we had a case like that at the gynae. A young lady around like 20 years old. Yeah, which I mean it has covered all the.
Why? What was she waiting for?
I don't know. Very big. Like, hey,
Jesus.
so you saw this growing. Sometimes they depend on a lot
think
of
maybe she was
herbal
shy.
medications. She was shy.
Coming
It
to
could be-
hospital, no?
Yeah.
Coming to
Then-
open her lab for you to see what is going on
Yes.
there.
And eventually, when they get to that stage,
Eventually,
they open up for you to see.
Ajay.
To be true,
So at this stage, do you need surgical?
Yeah,
Looking
yeah,
at
yeah.
what
It's
you're
a surgical
seeing.
intervention.
Oh.
Yes.
Greatness.
So it can be
Yes.
cured.
It can be cured.
Oh, okay.
Yes. So when it's that small, then when we have medications that we applied on
Okay.
just to burn it, this medication is not supposed to touch the real skin, just on the surface of the what
Wherever the growth is.
the growth is. Yeah.
Wow.
And about the hippies too, I learned sometimes, women do oral sex and stuff like that. And if you have an infant and you make somebody who is infected to kiss the kid or something like that, the kid too can, get infected.
Hey.
Oh, it depends. Depends on the kind of a kiss that we are talking about. So we have something that we call oral trash.
Yeah.
Yeah, or oral candidiasis.
Yeah.
Okay.
So that comes with this oral sex that you are talking about, from maybe licking and then BJ.
Why are you saying
BJ can also
Say
bring
I'm a
this
child. I
And
licked
what's
off
a
it.
child?
bacteria, antifungal infection. It can also cause oral cancer as well.
Oral cancer.
So
Mouth
that's
or
what
mouth cancer.
normally it can affect the kids, and then sometimes it can even kill them. Because I saw something like that on social media.
kids?
Yeah.
How old?
Like 1 year.
Dog,
Some
is
months.
that true?
It came on
Yes,
social.
it-
Like the person said, the sister kissed. Her daughter.
So it was in the mouth.
Yeah, and then from that day,
So the person
kid
had the
started
infection.
getting
Yes,
high
in the
fever
mouth.
and started getting rashes all over him. I
What
don't
kind
know
of
what
kiss
happened.
is that?
Because sometimes people
That is strange.
people breastfeed too. They give
Those
diseases
infections,
to
yeah.
breast.
Yeah.
Okay,
So
so,
wait,
breast milk
so-
too contain that.
You don't know.
It depends on the kind of infection that we are
Infection.
talking about.
Yeah.
Okay, so looking at the breastfeeding, now what kind of infection can one have or a mother have that can be transferred to the child through the breast milk?
Breastfeeding. So HIV and then HIV.
Just the milk.
Just the
You
milk.
don't know.
Yes. So that
Apart
means
from
that
HIV,
apart from HIV, hepatitis B,
Yes, hepatitis too.
so there.
No,
And
Doc.
then-
I want to understand something very clearly. Wait,
Yeah, Papa,
so I learned HIV is in the blood, which is
Yes.
the white blood cell, right?
Yes.
But the milk is not blood.
no, but it's from it's coming from your body.
inside.
And the
So
blo-
Your body produces the milk.
the milk.
So if I have HIV, I'm not saying I have, please. I have, and then I have
You
a baby.
breastfeed.
My body produces the milk. So once the baby latches on and sucks it, so that's why if you are pregnant,
you are putting on the antiretroviral
yes,
medication.
you are being put on that medication.
Yeah, so when the viral load is down, then
Yeah.
it means you can go ahead and then breastfeed.
Breastfeed.
Now you are seeing
Some even
But-
go give birth cry without their children having it, but
What
they
I don't
have
understand
it.
is how come when the baby is inside the belly of the woman, the baby can still be negative,
Yes.
but drinking the breast milk, the baby can be positive.
That is when the doctor, let me.
Yeah, because it's
In the
kind of
womb.
because in the
taking
womb.
doctor's work. Doctor, do your work.
I think the what we call the
Umbilical
placenta
cord.
or the that
Umbilical
one.
cord.
I think the blood passes through that thing to the
the
kid.
stomach. Yeah.
No, what passes through to the baby in the stomach is water, and then what we term as maybe feeding through the placenta.
The placenta, okay.
But it's not blood. The baby comes with its own blood.
But
So that is why most often when a lady is resource negative and then the partner is resource positive, automatically the baby is going to take the blood group of the partner. So in this case, if the lady was not given a shot, then it means the lady's blood is going to see the baby in the stomach as a foreign body.
Oh.
Do you get it?
Yeah.
So which means that it's not the same blood.
Not at
Okay.
all.
Do you get it?
So at this point, the baby is in the belly, but there is nothing like blood that goes inside the kid.
No.
From the kid being the fetus.
The kid being a fetus starts from developing from a sac.
Okay.
We call that sac gestational sac. So that sac comes first before the fetus develops in the sac.
So no blood from the woman goes inside the fetus.
No.
Wow.
Part of the hepatitis.
Okay, wait. One more thing. You see, the man will release the semen.
So that is why sometimes they normally contract if, for instance, the mother is not managed with the antiretroviral medications, and during delivery, the baby can contract the disease during delivery.
Because that one, the blood can go.
Yes.
Okay. But what I'm saying is, what if the man is infected? The man is HIV positive, right?
Yes.
When he releases in a woman, is the sperm not coming with HIV?
Yes, the sperm is coming with HIV.
And the sperm is the baby.
You mean if the man is positive?
Yeah, and he impregnates.
So in a case that the man has also been on antiretroviral medication and the viral load is very low because it can get to extent that you even test and it will be negative.
Whilst it's
there.
Okay, in this
because
case,
you're
the
on
man
medication.
is not on any medication.
Okay.
What if the man is not on any medication?
Then automatically the baby will be affected.
Yes.
That is what I'm trying, because I was thinking, if the man is infected, that means the sperm is coming with infection.
And the baby is
Definitely
infected.
Definitely.
Okay, so it's only if the person is not infected, that is when the baby doesn't get infected.
I don't understand this question.
The baby.
Okay, let me try and break it down.
Yeah.
Like, let's say the man is HIV positive.
Okay.
That one, when he impregnates a woman who is also HIV, the baby automatically is HIV.
That's okay, Doc. Okay.
Okay. So both couples are HIV patients.
They are not on drugs.
They are not on drugs.
Yeah.
Then definitely the baby will be an HIV.
Okay, so how is a baby inside the woman's belly and the baby is not HIV positive, but the woman is HIV positive? How does that happen?
Okay. So that is what we are talking about. All boils down to the antiretroviral medication.
Okay.
So when you are pregnant, you attend antenatal, unless maybe you are not visiting the clinic for A and C. Definitely, it's part of the routine labs that you are going to do. So we're going to find out that this is your case, and you'll be put on medication. You start taking medication, and not that you are just giving you the medication. You are being monitored, and then the viral load will be checked from time to time. You'll be asked to bring your partner to also go through the same investigation after both of you have been cancelled. Then you give you medication. So the baby comes out with a negative result.
So that means in this case, every pregnant woman have to go is being tested for
it's
HIV.
A must,
Every pregnant woman.
Yes, unless maybe you don't go. So, most of the men that I normally comes across when they come to the hospital and they complain about certain things and you want to screen them on HIV, they will tell you, why do you want to screen them on HIV? Me, I'm clean. I say, why clean? My wife went to antenatal. They checked her and she was negative. Clean. So I know
so
I'm also clean.
The wife's own.
Yes.
You say once you believe that, I feel like what he's saying makes sense to me, because if I am a man and I know I am not cheating, I'm not going around behind my wife. My wife gave birth or came to the hospital and she's negative.
It is fear.
Obviously,
fear.
I know it's the fear, but I mean,
on this same note,
fearing cell, but you are not doing it. So wait, so why why are you getting scared?
He's cheating.
Because
I
know that it's because of the needles.
No,
some men fear needles.
No, it's not about the needle. It's
just
about the word.
The results.
The word HIV.
Dog, I also know an incident whereby they both went to the hospital the girl was tested positive, but the guy was negative.
Yes.
But they have been having sex.
Yes.
Oh, yes, I've heard that issue
Yes,
too.
a lot.
How is
Yes,
that possible?
I've heard
A
that.
lot. So with guys, it's difficult for you to have bruises on your penis.
Okay.
Yes, so that is why most often when you are having sex, you need to make sure the lady is wet. So
So Amagwa is happy. I don't know why Amagwa said.
When you hear penis, no, then you are just all over.
Okay, Doc, continue, please.
yeah.
Hey!
So, but it's easy for ladies to bruise in there. I mean, sir. So it's easy for them to bruise in there. Then so, HIV. I mean, when you look at the percentage, women are getting more than
Than
the
men.
The men, because a man can have sex with a lady and then wouldn't.
No bruises.
So
Yeah,
that
wait.
what
It
actually
doesn't mean that we are supposed to go in for sex unprotected.
Exactly.
I understand, but Doc, what I don't
Protection
understand
is
is this thing is confusing me a lot. Women cannot infect men
They can.
without a bruise.
Yes.
So, what about the women? They are what do we call it? That watery. Doesn't it contain HIV? Or is it only blood?
No, it doesn't contain HIV.
What if somebody, let's say, for instance, I'm Kwa here like this, he's shaved, right? And he's having cuts all over his thing, right?
Genital.
Yeah.
And he's having sex with a woman, and the water from the woman enters the shaving parts where it have cuts. Can't he get?
I'll get
Yes,
he can?
The possibility is high.
this.
Okay, from the water from the woman or from the blood?
Yes, you see, as I said earlier on, they have some kind of lubricant in their vagina, which we call the normal flower.
Okay.
That does not contain the HIV virus.
Okay.
But then, when you stimulate them, the fluid that comes with it contains it.
Okay. So
So
the
it's-
fluid that comes with it, it mixes with the flora of the
Yes.
place.
Yes.
So that is an infected woman. You going in as a man without protection, without any bruises on your penis.
Without any bruises, you can't get
You
it.
won't get.
You can't.
Yeah.
You won't get
Okay.
it.
People are fortunate.
Yes.
Yes.
So you men there, hey, you people, you are lucky.
Yeah.
So me, I check my
Now
no
I
bruise
get it.
before.
So that's why anytime you have a sexual transmitted disease,
Yeah.
it is advisable for you to go for the HIV test too as well.
Yes.
Because I learned there was this doctor who came to educate us once when we were in school, and they kept talking about any person with sexual transmitted disease is a must. You have to go for HIV test, and I was like, is sexual transmitted disease the same
Related
as HIV?
to-
Yeah, because I was confused, not knowing because it comes with cuts, right?
Yeah.
Yeah.
Because
most especially cancroid and then syphilis. Yes. So those cancroid and syphilis is already an open
Open wound.
wound.
Yeah. So when you have these infections and you keep having sex, then it means you're going to. It's possible that you can have the HIV.
So do
virus.
people walk around having this syphilis and whatever you mentioned?
Yes, people walk around.
They
having it.
walk around with it knowing that they have it.
Yes.
Or unknowingly.
Okay, so usually, it depends.
Okay.
Some are really aware of their condition, but they feel shy coming to the hospital. So they rather depend on
Pharmacies.
pharmacies and all
drugstores.
those things. Unless maybe it's getting to an extremely. That is why most often, when as a guy you meet a lady, and then they try to prevent you from having sex with them. It could be they know
Because
their
of
situation,
that.
but most often the guys will force their way and then
And then possibly
Catch
do
it.
it.
I'm on cry, you
Say
listen.
You
ukwana
catch
ukotiti
that
and say na
thing.
wetiti na wo
You
dia
get
beda.
it.
Na wa kena kekeda. So
Hey, I know a lot of people are listening to this.
I'm
show
telling
because
you.
this is deep.
I mean, the spread is becoming so outrageous now that
it's crazy.
It's crazy. It's getting out of hands. You know. But Doc, do you think that over the counter, pharmacists also aid in this kind of spread? Because like you said, if the person goes to a pharmacist or an over-the-counter drugstore or whatever, and then the person knows that this kind of situation you are describing, the symptoms look like a syphilis or maybe something gonorrhea or something, why won't they advise the person to rather go to the hospital, but would then sell the medication to the person? Do you think that is the right way to go?
Okay, so the pharmacy is there for a kind of first aid, and then sometimes the pharmacists are also trained on certain kind of diseases.
Okay.
So they can direct you to go to the hospital. I've had a lot of experiences that the pharmacists are sending cases back to the hospital.
Very good.
But in a situation that you go and then you don't let the pharmacist know your condition,
okay,
then it will happen that maybe, okay, I have some vaginal discharges. You ask you what is the color of it, or it's yellow. All right, then they also give you medication. Go and try this medication for 7 days. If you don't see any changes, then you go to the hospital. So basically,
that I think is better.
So Doc, sorry, so you said something about odor, right?
Yeah.
Why are you interested about this odor?
I want to know.
Have you experienced something like that?
Oh, no, it's not like that.
No, but I mean, this
like,
is real
okay,
talk.
I'll be honest. My friend here, my friend Ezekam.
Oh my goodness, Ezekam is in trouble.
He was explaining to me. He was explaining to me about some issues. About some issues, you understand, that have been going on. That some women, they come with a very, very heavy odor.
Heavy.
Yeah.
Chai.
When we say heavy, it's extra heavy. Is it natural, or does it have something to do with this transmitted disease?
Yes, it has, because there is a normal.
Tony, you're a suspect.
Because I need
it's
to.
not
I need
normal.
to. No, yeah.
It's not normal to have
For vagina.
Emphasis on odor, Tony. Why?
Yeah. Because
you explain. Let the doctor.
I will explain.
Yes,
okay.
You have to explain.
Chlamydia
back in school, back in, me, I went to boys' school. Okay, I was in boys' school, and trust me, almost all the friends I had back then, they complain of these things.
Okay.
It came to a point, everybody was believing that it's a normal thing on every woman. But I came to realize it's not like that. It's not like that.
How did you come
We're
to the
now
realization?
growing. If you are growing, you will get it.
That is what I'm saying. But I'm kind of confused here. Does every disease comes with its own odor? Maybe this one will be like carrot smell. This one will be like guava smell. This one will be like. So does all of them have their own?
Okay.
Yeah. As I come say someone to, it's like kako.
Hey.
I don't know if you know kako.
Okay.
Okay, please, Doc, explain the kako and break down. Tell us the type of smells.
Yes.
Pungent.
Yes, how
Some is perfume, or some is guava.
And then how to detect if this particular kind of smell, what it's related to, what kind of sickness is it related to, or infection. So let's go.
So I have no idea or experience when it comes to the odor
aspect.
Saying that this odor is from chlamydia or trichomoniasis or gonorrhea.
Trichomoniasis. That one will come to it when we finish this one.
So basically, bacterial vaginosis comes with its odor, and then chlamydia also comes with its odor.
Okay.
And then the trichomoniasis also come with it odor.
All these names are diseases.
Diseases, yes. They all come with their odors.
You are done, no?
Yeah. So basically,
which one has the most pungent smell amongst these three?
I think chlamydia.
So that one is the one that gives that a very offensive. That one
and
gives
then
very offensive.
infection. Fungi infection. That's
which is candidiasis.
Candidiasis, yeah.
Okay.
That one too gives.
I think that one is common
odor.
because most of the students they use the same urinal.
You get.
Doc, please let me ask you
this.
If two women use one washroom, right, and one is infected with, let's say, one of these sexual transmitted disease, how does the other one attracts the disease? Because they keep saying that because I use the same washroom with this lady who was infected, I'm also infected. But I don't get it. How?
Okay, so usually, apart from using a towel together,
okay,
because they normally reside in a moist area for a longer period. Aside that, they can also be on the door handle.
Okay.
The door handle for some time.
Okay.
And then also the toilet seats as well. So these are kind of things that you need to look out for. Because since they can be on the door handle for a period of time, and we all use the same door handle. And I mean, when they go back to the washroom and then put their hands in the vagina, so you are transferring this infection from the door handle into your vagina. So these are basic things that we need to look out for.
Yes, it's true.
So that's how the students is crazy there.
Yeah.
Everybody.
Because almost all the students, they normally complain about these same issues. Back then, when we were in school, they always complain about, because they were all using some nonsense washroom. Even we the guys, sometimes some of them complain about the same thing. You know, I don't know whether it was the splash that comes back to you, or it was the seat that you sit on.
The seat.
Me, I don't sit on the seat. I stand on it.
What about the pit ones?
The pit ones
comes with the heat, right?
Yeah, that one comes with the heat. You see, I mean, as I said, even here that we are sitting, there are infections around here. You will just be prone to this infection when your immune system goes down. So just imagine we just finish, we shake hands, we do all the things, then you go and put your hand in there.
Without washing your hands.
You are transferring infections there. You get it. We all have nails, and then all those things, they can be in our nails as well.
So the heat, that comes from the pit, does it give such infections?
Yes.
Like you name. Wow. Just the heat.
Just the heat.
What is in the heat? Because now,
so the bacteria are flying inside.
Yeah, because I want to get it. Because I'm thinking
in
that
the vapor too.
The place is hot.
Inside.
So how are they able to thrive and live there? Red.
Okay, so
and then looking at the pit, you are on it. So nothing of that sort is going to splash or touch your vulva or vagina or your penis.
So that is the heat.
Yeah, the whole place.
So that one I think is even better than the seat.
Because even the stool, the poo is in an open space.
Oh boy.
You get it. And
no, but the whole space is covered. It was just some tiny spaces that they've left.
It is air that will blow that.
Exactly. So still,
since I mean you're going to open your labs,
the whole thing,
prone to infection and that
instantly. So looking at the toilet seats and then the pits, which is better?
The toilet seat is better.
What?
Deadly.
Oh, that explains it.
Not even one
most of the senior
house like this.
Then go back with the virus.
No, I mean exactly those big house flies. Oh Jesus Christ! So you just
school is suffer.
I'm telling you.
And as I was saying, you see this normal flora that I was talking about.
Hey, then they are killing us.
It's in the vagina. This normal flora, when they move from the vagina to different place, they become an infection. So, for instance, we have a normal flower in our anal area, which also protects the anal,
The anus.
and then the feces that comes
That
out.
comes out.
Okay.
So if this normal flower also finds their way in the vagina, it becomes
Okay.
an infection.
That is where then anal sex is going to come in.
Yes.
Mm-hmm.
Some
Because definitely the
bacteria, E.
insertion
coli.
goes there. Some men do that and then bring it back into the vagina. Thinking
Blood of Jesus.
you've been doing it.
Hey!
So they
Why
are
you saying
mixing
this?
it anyhow. You bring
You are
this one
mixing
I'm
in.
a Christian.
So I mean, looking at how anal sex is being done, and then how the men transfer the penis from the anus back into the vagina, all in the name of having sex or having fun. So in your own terms, you mean that in the process of doing that, you are bringing out the bacteria from that part
But to
into
the vagina.
the vagina.
locations.
And so
Transsexual.
that is called what?
Different locations.
I thought it's a crop rotation.
Yeah, these are the shifting cultivation.
I'm telling you, there's a cultivation going on there.
Shifting cultivation.
So that kind of infection, what are the type of infections that you can get from such processes or
So that is,
such?
an infection with a bacteria which is called E. coli. That is the commonest.
It's called what?
They
E.
have
coli.
nice names
E.
too.
coli.
Mm.
Oh my goodness, what's that?
It's also a bacterial infection. Which
Okay. And
will
what are the
also come with
symptoms?
You're having a frequent urination,
Okay.
vaginal discharge, and then you can have what we call dysuria, and then a painful urination.
Urination. Those are.
yes, sir.
It's similar
So
to.
that means all of them
I
have
say
the
gono
same-
similar. Yes.
They
They
all
are
have
similar.
same symptoms, unless maybe they are not treated when they migrate to different.
Okay,
Uh-huh,
that means
then-
they graduated to
Yes.
the secondary level.
Yeah.
When they come to the first degree, that means you are going down that.
So the hepatitis, if you are pregnant, the child won't get unless born like the HIV.
No, the hepatitis
You will get.
you get because you need to be treated.
So the ecolysis, right? Or eco what?
E. coli.
E. coli.
Their name too is nice.
A very interesting name.
That is a bacteria name.
Okay, that's
so-
the name of the bacteria.
Yeah, so just like
So
the
that bacteria
candidiasis-
nakasa no. Okay, come. Just like what?
the candidiasis, the causative organism is Candida albicans.
Okay.
So just like the E. coli,
E. coli.
also being a form of a bacteria infection.
So E. coli nakasa no there, it thrives inside the anus
Yes.
or around it, inside.
Inside.
Okay. So let's say your partner loves anal sex or enjoys anal sex. And wants to, penetrate in both areas, both the vagina and both the anus. Should he wash after penetrating the anus?
Come and
And
do this.
come and
Hey,
continue.
That is work. Oh.
Yes, now because transferring it from here to here, they say serious. So equal now, and you know. No, because that will not. This thing will not stop people from having.
Like you
anal
have
sex.
to put water there. You do it.
It's that people say doc say
Bro.
we can't stop people from doing it. And you know what are we going to do to prevent the E. coli from transferring
The E. coli don't
from
stop. bro.
from the anus?
That thing will even
To
be nice.
the
You do
vagina.
you wash. You do you wash. You do you wash. You do.
No, that one is your own. Let's listen to what the doctor has to say. So, doc, tell us how we can prevent that kind of transfer.
Well, it's an unhealthy sex practice that we're talking about.
Yeah.
But then you can't prevent it because you can't. This is someone's what do we call
Fantasy.
it? Fantasy.
Yeah.
That they won't. You can't prevent it, but I would advise, as you're saying, before you, after the anus before you enter the vagina. If you can wash it, that is better. But then I'll also say that if you are a fan of practicing this, then you need to be visiting the hospital frequently. Yeah, just to check yourself.
Okay, now, Doc, this takes me to homosexuals. Them, dear, we know, say, by gay, by batty. That's where they enjoy their stuff. That's what they like to do.
Yeah.
So now, looking at this bacteria that is living there, and a man's penis, you know, there's a hole for urination.
Yeah.
So now, is a man prone to getting this if you practice the anal more? Are you also, if a man also penetrates that place and then gets the bacteria, can you get it? You there, let me ask that one first. Can you get it?
I mean, there are a lot of infections that you can,
because now it's not entering the vagina. It's
vagina.
Just anal penetration. Just there. So you, the man penetrating the anus, no, can you get that E. coli in your penis?
Yes, you can.
So you too, when you get that infection in your penis, now what is the symptoms?
Usually it's burning sensation and pain when you are passing urine.
Wow.
Yeah, this bacterial infection, and then when it goes further, it can affect goes through the bladder, goes through the kidney, and then affect the
that's
kidney.
how come they end up getting kidney infections.
Yeah, so we call it pyelonephritis.
Jesus.
So it affects the kidney, and then
Everything
oh my goodness.
If not treated.
Then the E. coli in the hoarding.
You'll be crying. You'll be crying.
So why do people practice this thing when
Yes,
you know at the
fantasy.
end of the day you are going to have your kidneys destroyed?
Yeah, it's fantasy.
Doctor, you are telling me something today.
Yeah.
So is the E. coli that causes the kidney?
Yes, and
the
apart from
bladder?
that, there are a lot of bacteria that can also migrate into
the kidney.
If
Yes.
not treated, that
Yes,
is the
if
thing.
not treated,
If
good.
not treated.
If
So
not treated.
how long would it take one to know, say, E. coli is in my
It's causing
penis?
it,
Okay.
How long?
So usually when you have a UTI, urinary tract infection,
Okay.
which comes with its symptoms, painful urination and all those things, you realize when you take some medications, when you go to the hospital, they give you medication. Within 3 days, all these symptoms will ease. That you feel like, oh, you are being treated, you are okay. So you put all your medications away, but these bacteria are still there. So they migrate from the penis into the bladder and find their ways into the uterus and then enter into the kidney.
Goodness.
So it takes time before they are able to get into the kidney. That means if you are not
treating it.
treating it, some prefer going for some concoction and other things. Immediately you start taking those medications, all the symptoms, even when you don't take any medication and you are taking enough water, and it takes time, you realize that the symptoms are no more there. So in your mind, I'm okay.
They are hiding.
Then they migrate to different place.
But Doc, I also heard sometimes when, let's say a disease, let's say this sexual transmitted disease lasts on you for a very long time, and it starts affecting your kidney. Sometimes too, it happens when you are taking some antibiotics, because they said there was a saying that the more you take antibiotics, the more it damages your kidney. So if the person is trying to cure these transmitted diseases, is the person not damaging his kidney as well?
No. You see, we have different types of antibiotics, and then what they do. So, I mean, when you visit the hospital, definitely you'll be tested. Either you'll be doing a urinary or urine culture.
Exactly.
The urine culture brings out the type of bacteria, and then the medication or the drug that
that's
can
supposed to go with it.
Yes, with it, then which will be prescribed for you to take, and then you are good to go.
So, Doc, before we leave the E. coli to another thing, I'm interested.
E. coli.
Yes. So looking at a homosexual, who is the feminine one? You know, there's male and there's female. So both are males actually, but in this case, there's a female and there's a male. So if you, okay, let me use Tony and Amankwa. Amankwa, don't. You are the two people I can use here.
So I'm
for
the
doctor,
female.
yes. So I can
That
create
is
the
the
scenario
male.
well. You are the female, and you are the male. Hey,
So,
easy. Things are going on behind closed doors. We will show behind the scenes after the program. So let's go on. So in this scenario, Tony, you are the male. You are the by gay by Batty. And then this is my female here. So now, looking at these two, female no will not be doing any anal do you get it? You are not
this
getting
one
it.
will be doing me.
He will be doing you. Because Anna,
that is how it happens.
do you get it? Because once you're a female, you don't have money. You don't have anything.
So
you
my
don't
thing
call the
doesn't
shots.
work.
You are on
So
their
you
sleep.
will be doing
Kenakakada. So this man is the one that will be doing you. So as he is doing every day, no, he contract? One, fine. Let's say he's prone to getting it, so he can get it. And then two, you that you are not doing, no, as he's releasing into him, will he also get it? Or since he is the one doing the insertion, he is the only person going to get it.
Okay.
I hope you understand my scenario.
Understand. Yeah. So the anal area was made in such a way that it was
personally for shitting.
Yeah, basically. That is mainly the purpose.
Yes.
For passing of poop.
For
Some people say they have upgraded themselves.
Too, yeah. Yeah. So a frequent visit of the area would erase all this normal flora protecting the area, and they also try to wash the place before they go in for sex.
So you have to wash it clean before.
That's what they do.
So you don't need to even wash it. Oh,
They wash it.
They wash it to make sure the place is clean and neat for sex.
For penetration.
So as this continues, then it means there is no normal flora protecting the
the washing breaks the flora around the area.
And for their mind, they think they are doing themselves
clean. Yes.
Because the place has to smell good.
Yes. But they don't know they are rather killing the place.
Yeah, exactly.
The normal flora that if the penis is carrying any bacteria, would hold the bacteria and crush it or fight it.
But God actually created human differently.
Yes.
It even have a protection.
Yes.
On its own.
Females, they have it.
Yes.
It washes the place.
Yes.
Yeah, I heard about that one too.
Yeah.
On its own.
They said women naturally they have this fluid which
that's what
cleans
he's saying.
them.
That's the
that
flora.
wash.
Yeah, that's what he's saying. So now, Doc, go back to what you were explaining.
So basically, since the normal floras are no more there and the place is open for any infection, the penis also coming out from outside can also affect
infection.
And there are a lot of bacteria infection. A lot.
Aside the E. coli.
Aside there are a lot of them.
Like what?
Okay, so even studies shows that new ones keep popping up.
I think it's curse.
Is it because of the practice? Is it because of the homosexuality that has become, rampant these days?
Of bacteria.
That's how come we are getting different bacteria now.
And also how
it's birthing new ones. Actually,
new ones each.
So, Doc, if I may ask, they are saying that if you count the number of male that are infected with the HIV, most of them are homosexuals. How true is that? They said most of the homosexual male homosexuals, most of them are HIV patients.
I haven't done my statistics, so yeah.
Well, in my own thinking, I will say if what you're saying has, studies
Yeah.
proving,
Yeah.
then that means that looking at the analysis, penetration in the butt, definitely there's going to be some pressure, there's a force.
That was what I
The
was trying to
lining
say.
So
that is there.
exactly.
Because I heard because of that.
Aside getting loose, it might be
They get
wounded.
cuts.
Yeah.
Yes.
Cuts.
Because
They
of
get
the
cuts.
force.
Bruise easily.
Yes.
That is why when you do it for long, if you don't wear pampers, no, that
You are looking at the linkage.
If you don't,
Dog,
you
so
believe
that one.
Elasticity.
Yes, it loses it.
Yeah, we have what we call sphincter.
Okay, so that's what grips it,
The
holds
sphincter, the mind controls the sphincter.
it. Okay.
We have sphincter in esophagus so that the
Okay.
food comes
Up
back
again.
again. They prevent them from coming back
Coming.
up
So same application as
at the anal
the
area.
feces, not coming back. So
Yeah.
it holds
So it
it
will lose
in.
the
So when it gets
concentration.
full over there, then the brain signal it that
You need to come out.
then it will lower it and it comes out.
Okay.
Yeah, so I mean, when you keep pushing, I think you can have a problem with the sphincter, and then
And can it be solved surgically?
yes.
It can.
But I think I think it got something to do with spiritual side too.
which one is which?
I think it's a curse. I think
Someone
it's a
is going
I
back
think it's a
and
curse God actually gave those people, because looking at
No, but
these
that
people,
is
most of them they
someone's
died from
way
HIV. Dog, I mean, there was one in South Africa. That one died from HIV. No, that one died from cancer.
Yeah.
So that one you can
Yeah.
get.
Yeah, anal cancer.
Anal cancer. What causes that?
Okay, so I mean, the cancer comes in as a result of tissue overgrowing.
What tissue overgrowing where? Inside?
Yes.
What kind of tissue?
Okay, so
Maybe
we have what we call wear and tear,
Okay.
and every part of our body we have those things there. Even in our mouth, in our tongue, sometimes you can see it's kind of wearing off, coming up from your mouth. Whitish, and there are dead tissues that are supposed to come out.
Okay.
Now, in a situation that these dead tissues that are coming up, the new one must come.
Okay.
But in a situation that the new ones popping up is coming more.
More.
Usually, the major causative organism is the human papilloma virus.
Okay.
I think you can't want some credit that the HPV.
HPV, yeah.
Yes, and then they cause those cancers in the anal area. And as is a sexually transmitted disease, I say ubia betumi enyabi common ubia once you are sexually active
active in quality.
yeah, you are prone to those kind of infections. And if you are not, protecting yourself, you are prone to those infections. But when it comes to this gay lesbian, because of the nature of how the anal area is, so they are also prone to this anal cancer. So that is what causes the anal cancer.
So that's what you see, that they will be shitting themselves anywhere they go. Like they will just be leaking anyhow.
The place is loosed up.
Yeah, when the place losing up it's not a cancer.
Okay.
Okay, that one too is different.
It's different.
It's also a different thing on its
also
own.
different. As I mentioned about the sphincter. So when the sphincter is damaged, then it means it can't hold the
feces.
You see, the rectum is a store area where the feces store. And then in that area too, we have the sphincter, which blocks the feces from coming up until it is full, and then the brain will signal it that
Yeah,
okay,
go to
It needs
release
to come out.
the poo, then it to come out. So if the nerves over there destroys the nerves that the brain signals it to release the stool, destroys, and the sphincter is also damaged, then definitely you're going to poo without even knowing. The
You
poo
won't
is
feel
coming.
it too.
So
It
that
will
is
come.
when you don't even feel it.
You won't feel it.
So nama not just say poor.
Yeah.
It just come out.
So the pampers
Jesus. So
is
that
there.
is when they tend to wear the adult diapers.
Yeah.
Yeah.
So
See,
in case it comes.
By
it will
gay, by
stop.
batty.
It will stop.
Up to you.
Doctor,
Batty
the
boy.
HPV. It's skin to skin contact too.
Yes.
You can get
You
it.
can get it too.
Yes.
That one is the serious one, oh.
So from sweats.
From
So
sweat,
that one
it's
too
not
is
about
like
sex, so
it's like that one hepatitis
B.
B, yeah.
skin to skin you get.
So definitely, what makes you, is it maybe BB infection be on the skin, and I say sweat.
No, the virus is there.
Virus. So once our system ni
The body fluid.
it's me penetrating and I say manifesting from
Yes.
or body fluid and I will cut.
Yeah. Into
Wow.
the TBI no say yeah, body fluid and I say blood
and
and I
so
say
on,
betumi film weba.
It's very dangerous.
Wow.
Very dangerous.
So that means that by gay by bati yeah. Not just say nyama miensa way you are getting either the anal cancer, your sphincter is going to be damaged,
Destroyed.
In the nerves.
and your nerves. And then what again are you prone to? HIV.
Yes.
So these three things are basically what you can achieve as your benefit from being by gay.
that is your gift.
So yeah.
I am for
We are not saying that when you are gay,
By Betty.
then it means
You are getting it.
you have this kind of.
But you
these
are close to getting it.
yes,
You are prone
to
get
get
it.
Yes.
So it's the same.
these things. So we are just telling them. Say yeah, we there. Say yeah.
we are advising
We are
you.
just saying it. It's a real talk. So we say it.
So,
as it
Doc,
is.
you saying this led me to HIV. All right. So apparently, we heard on the news that there was this girl who is infected with HIV, and now she's willingly infecting people with the virus. And she was bold enough to come on social media and
Say it.
to tell people that she have already confirmed 40 people that she have infected them with the HIV. In this case, don't we have any law that anybody with HIV, if you infect somebody with the HIV, you have to be arrested? No, they have to be rules and regulations.
You enjoy yourself. You want us to
No, because
you.
I think you doctors, you are the ones causing this issue, because if you are allowed to inform we the innocent one outside that hey, so and so is infected with HIV, so people should be careful. I think all of us will be careful with that person.
You
That's
can't do that one, no.
stigmatization.
Sure.
Yeah, but their stigmatization is what is causing us to die too.
No, I mean before you are diagnosed as an retro patient, you are being cancelled. Even before we do the test for you, you are being cancelled. And then you are aware of what exactly is ahead of you. You are being given the medication, and then you understand the whole situation. So I found it so disturbing that an HIV patient will be going out spreading
The virus.
and then comes on social media, claim that I've infected 40 people.
And
How
she
would you
says
know that
she still
you've
said
infected
she
40
Exactly.
people?
How does she know?
How would you diagnose all these people that
Yes.
you've had sex
okay,
with?
according to her, say she's not well educated, so she doesn't know much about these things. But according to what she's saying, she slept with 40 people.
Okay.
That is what she's trying to say. But she don't know whether she infected them. But these 40 people, if we are being honest, they all have like 50% of being infected, which is still the same thing we are talking about here. So to me, I feel like why don't the law give us the permission to tattoo HIV positive on anybody that have HIV? There have to be a signal on them. Because some of them are wicked. They are so wicked to the point that they know they have the thing, and they will still go ahead infecting innocent people.
Okay, so that is why education keeps going on this same social media, on the radio station, and on TV as well. So all of us are aware of ways of contracting HIV.
So you don't go there.
You don't go there. I mean, you try to protect yourself.
Yeah, protection.
So if you are not protecting yourself,
the government should fight for you.
Protect
yourself.
No, listen.
You have to fight
What
for
I'm saying, you
yourself.
don't understand.
So
if I have a heads up that so and so is having this,
How is that possible?
then I will know how to do my
How
thing.
is that possible?
it's private. Your results, would you, Tony Hans,
Yeah.
go in for an HIV test and come and boldly put it in front of this camera? Hello,
even
look at
HIV,
me.
you've gone that
I'm
far.
negative.
Let's talk about gonorrhea.
Say HIV.
Gonorrhea,
no
will
crampo.
you say
Would you,
it?
say
Would you do that?
I'm a gonorrhea.
No,
Patient.
see, dog.
Patient.
No, it's a
Dog.
question to answer.
Yo, I'm answering you.
No, wait.
See,
Yes or no?
Papa,
Yes,
wait,
I will.
pa.
You will.
yes. I
Okay,
will.
hold it. We'll come there. You said yes.
Yes.
We'll come to it. Dog, let's go to our next question.
Okay.
I want to find out if the usage of sex toys aids in the spread of these sexually transmitted diseases. Now, sex toys usage has become something that has become a part of our day-to-day life. It has come to stay. This is our Gen Z generation, dear. And one echo.
Wow.
Yes, that is the order of the day. If you
didn't
don't
know
have
about
one
it.
in your bag, Amankwa,
It has not come to stay.
Hey.
Because some of us don't know it.
you there, you don't know. You're a kid. You don't know. Which one do you use most often?
This is my first time actually hearing about, but I've seen them. I've
The
seen them
one-
online, but I've not.
You've not actually
They are
touched
physically.
them.
They have
Yes.
not seen some.
You've not even touched
Myself.
it. Dog, you
I've
too.
never seen it
I've never-
physical.
but
I'm
I
shocked
always
though,
see it
dog.
online.
You've not touched it.
No, never.
Not even seen it.
I've never seen some before.
Okay, but me, they have seen it before.
Okay.
So the male ones, no. Let's talk about the male ones
Okay.
because the female ones they be kwa. Yes, a lot of
Wow.
it. We have different sizes.
Sizes.
Breaks. Amankwa, you were
My size
demonstrating.
too,
Yes.
yeah.
How you said the vibration? How is it like? Amankwa, do it for us to see.
Hey, Amaka.
No, whoa, please do it. Give us
Doctor, you are a
a
doctor.
vivid
You say you've not seen
description.
vibration
Also,
before.
we are to the channel.
Some people plug it, then they sleep, then they too be.
Amankwa, no fire first speed.
We
First
have
speed.
5 speed levels.
Okay. For the penis, right?
The penis.
Yes, we have 9 inches,
yes.
10 inches, 11 inches. You know,
13 inches.
13
Too.
inches.
And the speed level is 1 to 5.
we have
so
one
that
that the veins are not so visible.
showing, yeah.
Yes, please. We'll show you everything
Yes.
so that you have a fair idea of what we are
Wow.
talking. We are just describing it. Next time, we'll bring it here and display it. Eze, you are here.
So the first
Eze, you are
vibration,
here.
G.
You are an advocate.
That is level 1.
Please, level 1 and then
G.
G. Okay, financial level 2. Take us to level 2 vibration.
G.
G.
Some people put it at level 5, then sleep.
Hey!
G, huh? G.
That means that one there is a professional one. No, professional.
I'm telling you, people are
Hey.
doing things so.
The level 5, no, how is it going?
G,
Like?
huh? Like you do the year that you want to break, but it is inside. So do Doctor, you have to
Does it speak Chinese?
This is crazy.
sound today, speaker today.
So what is Hygiene? Is it speaking Chinese or what? I don't understand. Is that a language?
It is spoiling things.
Really?
So-
And they insert it and sleep.
I'm a man. How can I vibrate inside
No, but
you?
not all. Well, some that I have seen, no, it doesn't come with the vibration. Some are just the normal dildos. That's what it's called. So it looks like there's a sticker. Saying phone holder. You put it on. You see the sticker under it, no? It comes something like that because it's in a silicone
So
foam.
it will vibrate.
So on the seat table on this one,
No,
then
I
on
think
one, yes, you satisfy yourself, but that one doesn't have. Some don't have vibration.
Going up and down.
Yes, you will do it how you want it.
The one is gone.
That's
And
the
it is
female one.
plugged, so
The one-
no
the one is
tire.
gone.
Some
This
are
is
not even
crazy.
plugged.
The one is gone.
Some there is
yeah.
manual.
So, Doc,
But
I
I've
want to
seen
ask
some on
something.
the- on the social media before,
Yes.
but then physically,
Physically,
I've
there
seen
you've
some.
not
So-
touched
No,
it.
I've not
Dog,
touched it.
in case like this, if a woman becomes sexually active on these toys, can can it affect her feelings for men?
No, wait. Before you answer that question,
Okay.
please, I want you to let me understand, or let the viewers get to understand, that do these things aid in the spread of sexually transmitted diseases?
Sure.
In what way?
Yeah, because you see,
Don't forget your own.
Yeah.
Right
Yes.
after this, then.
it's just like an instrument that you are putting in there, and no matter how hygiene you keep it, it wouldn't be as what we call it, the penis. Yeah.
No matter how clean you keep it.
I mean, so actually, I don't know what to say because I've not
You've not experienced it.
Yes, and I don't know how it works.
He gave you a scenario like that.
I'm giving you that thing.
How
Yes,
they make
everything you're describing,
Oh,
Bibiama.
I should do it for you to see.
Or we should give you a video for you.
Doctor, it is
So,
part of doctrine.
You understand? We are even trying to explain with diagrams and description.
It's a rubber.
Definitely. Since it's going through the vagina, you are prone to an infection.
No matter how clean you keep
could
it.
be these new kinds of infections that are popping up.
Exactly.
Due to this.
There are
Exactly.
new ones too popping up.
Every
The
day, new
bacteria.
ones
Yeah,
pop up.
sure.
Every day.
Because even the by gay by bat, they use the dildos too. So imagine if maybe you have the E. coli there. Now why insert it? So you two, you want to now you the two now and me you sumo. So you the female no, since you are not enjoying him, why you
I've enjoyed the thing, the dildo.
yes, so you dildo no, maybe your this one is maybe too big. Look at your size.
How?
Yeah.
You are 18 and he's
34.
30 BB 40. And see, looking at 40 size, 18 no dear. A bit proud. So then I would then give him your own dildo to be doing it
For me.
for you.
Based on my size.
Because of your size and maybe looking at the space the hole how it is no. Ube pra. So also we are maybe he too wants to have a feel of a say you
So
become
that same
partner.
thing,
That same thing then
And the echo.
I understand what she's saying now. I get it now.
Now
Yeah,
you
yeah,
get
yeah, yeah.
infected.
so it's just fun
Yeah,
that
you
you
can
people
catch
are
you,
yeah.
but at the end of the day no
Sharing
multiple
the same
people.
sex toy.
Yeah.
Some people borrow it too. Like,
Yeah,
do you
yeah.
have it? Give it to me. I'll bring it to you 3 days time.
can you imagine
Just imagine.
So
Take
I think
it.
that
This
one there,
thing is
even
not
me
something
not
we
as me
share.
not a doctor, I can boldly say you are getting infection if one of them is infected 100%.
definitely
Yeah.
definitely
But Doc, back to my question. Yeah. You see, in this our era, I see a lot of people are engaging themselves in these sexual sex toys, especially the women. You know, there are certain things that sex toy would do that we men we can't do, no matter how we do. Me, I can't make my hands vibrate.
Why?
You understand? My hands can never vibrate.
So please
Compared to the vibrators, they can really vibrate.
if he goes on
Levels.
the first level
Yes.
G.
See, the G, maybe my hands can do, but
Some
the
people are
that one,
upgrading
I'm not.
so the
I'm
level
not to
5
that
now,
level.
how is it like
Yeah. Aha. See,
so
that's
that
why
one,
that
you can't do
one
it
I can't. So now, Doc, can't these sex toys kill the feelings or the what we call is it libido? For that thing women
The
they
desire
have the
for men.
desire for men. No, can't it kill it?
Yes, it does. Yeah, because already, I mean, if she's feeling honey, she has already certified herself already. Yeah, so it becomes very difficult for them to, I mean,
Ask for you.
yes,
Come and do
ask
it.
for you and all this. They always help themselves, so before coming up. So it really affects relationship and then marriage as well.
exactly
Yeah, because
And,
but this thing is supposed to spice up marriage.
are you sure?
Which one?
Well, that's what they say.
Hey.
No, literally, spice up marriage and relationship. Okay, let's say maybe you have a partner who is used to this or who likes it. maybe just to stimulate the clitoris, because we have different, not just the Gigi dildo that you are thinking. You there one way now. Now you are thinking one way. We have different types.
Okay.
So yes, so we have some that comes in a bullet form, very tiny. You know that some men, you people, you are saying, wow, you don't like it. Am I lying? Hey, come. Don't pretend as if you don't know what I'm talking about. You are here. The men too like it.
Like what?
Like the usage of the sex toys on their women.
Hey.
Whilst the manhood
So
is
doctor,
there.
you've not heard about that?
No.
The manhood is there. The manhood will be performing what it's supposed to be performing.
And then,
but
dildo
helping
will
the
be
woman reach climax,
Hey!
they use that.
So you see,
we have a lot of ways.
So how can you make a woman reach? Because there are some women whose kind of their feelings are way behind.
Way behind. Yeah, that's
so
true.
you have to work.
You have to work on
No,
that.
it's a medical condition.
See, no, that's why.
That one's
I
a
wish I
medical-
can.
not
I can.
everything
I
is a
wish I
medical
can chip
condition.
in this one.
Not everything.
I wish I can chip in this one. This one is a psychological thing.
yeah.
It got something to do with your mind. So, from what I know about this thing just that you just narrated, you know, women are created in a special way. Okay, if we go back in the olden days, let me use animals for instance. You see, goats, sheep, cows. If you see the females, no matter how many kids they get, the male ones still do it without no problem, which means that is exactly how God created it. No matter how they give birth to big babies, it will still come back to normal, and the man will do it and the woman will still enjoy it. Back to we human beings. You see, God created us in a way that like men are supposed to have one woman each, and women are supposed to stick to one man each. So in so doing, we humans have upgraded our knowledge, thinking, okay, maybe if I try this man, it might be better than this man, because this man might be heavier than that man.
Yeah.
So in so doing, we have created different hosts which were not meant to be created. So let's say I get a woman, this woman now, she's a new woman, she's a virgin. I start everything with her. Now, the moment I start with her specific shape, the shape that I put in her is supposed to be my shape. Now, if this same woman moved to another man, now she changed my shape to a different shape. If she keeps on going to different men, then her shapes are going to change to different shapes. At the end, she will not be able to find her shape because there's a lot of shapes that she have already encountered.
I keep watching them. That is when I keep having a high desire for sex.
It's true.
Yeah, but when I refrain from all those things, and my mind was focused on business work, you see, I'm not. You don't
even have any
feelings for those things.
That
So
thoughts
when
wouldn't
you
even cross your mind.
yes, when you find yourself so idle, especially the ladies who have completed secondary school fresh, and
They
also
have
those
nowhere
and
to
they have
go.
nowhere to go. They are watching their
now it's
phones
even
and then
on
watching
sites.
some porno and all those things.
It's very easily
giving them
accessible.
these high sex desires.
Yes.
So that is what is pushing them into all these things.
And then these people who take the reds,
Good.
with them red.
Red.
They are more than the vibrators. So
Hey.
those red
Red,
people,
Yeah,
the vibrator will be on. They will be on. The vibrator, we see smoke coming. Smoke will be coming out from the vibrator.
Why?
This one will be
They
still doing that.
overused it.
There should be a time that we can have a talk on this.
Oh,
on
But we
red
are
and
talking
tramadol.
doctor.
Yeah,
You see them, let them
drugs,
know.
abuse of drugs.
Yeah.
I think it would be a
Then,
good one too.
I can even really take you guys into details.
Yeah.
Okay, Doc.
Yeah.
Let's go to treatment and misconceptions.
Okay.
Tell us some of the biggest myths you've heard as a doctor about these STDs that you would like to clear up.
Okay. So, for instance, gonorrhea.
Okay.
Yes. I realize most of the times when they come to hospital and we diagnose them, some are like, hey, doc, when you say gonorrhea, the baby drone, they treat you. You say, oya maybe drubina no more ultimate treat gonorrhea. Those ones, as I keep saying, these medications that we are giving are what we know. So when you go about taking certain medication that are not prescribed by a professional person, then these symptoms that you are having maybe ease. You're not seeing the symptoms again in your mind. You think the symptom is gone, but the bacteria has migrated from the urethra either to the bladder or to the kidneys.
Migration is going on.
The migration is going on there. Yeah. So the misconception about gonorrhea is being treated by herbal medication is false.
It's false.
Oh, for real?
Yeah.
Yeah.
Boom.
Totally. So they should just visit the healthcare
herbal
center.
medication that can treat gonorrhea.
You have no idea.
I have no idea of it.
So that means they are really killing a lot of people, dog.
Oh yeah, said they are making money.
If you go to town right now, all you hear is gonorrhea. How do they say it in Chief? Baba Swedro. If you go to Kaswa right now, the noise you go hear
that
there.
one works. That one works.
So how
have
did
you
know?
tried it?
That one works.
Doc is telling you that those things are
No,
myths.
doctor can be doctor.
It's
We
myth.
have personal
Doctor said it's
experience.
a myth.
Someone is telling you something from.
So you
us.
okay? So
So
experience.
you have someone who-
exactly.
So
tried and tested.
were you infected and then you kill yourself with the drug with those things?
Did you-
one of my
did you-
brothers got it.
Your brother,
Your
not
brother?
you.
I
How
was
many
with him
brothers
there.
were
Listen to what Doc said.
How old
Sometimes-
was he?
Which one? My senior brother.
Your senior brother.
He got it. No medicine was working.
Doc,
We went to one place. They gave us the root of
Namibia.
20.
Okay.
20. I don't know what it's called in English. I
We
don't even know what
used
it
it
is.
now. It worked.
Tiger Nut
so
tree.
it could be that.
really?
Yeah, Tiger Nut.
I'm telling you, it worked.
Yeah.
Doctor, you know it.
Yeah, it could be that
I
we
don't know
have
what it is.
we have the herbal medications for that.
That's yes.
But the challenge with that is, you see, we don't have
Know the correct
dosage.
ones.
yes, and we don't have the patience of preparing the medication,
medication.
and
That is
packaging
it.
them in a nice way. I mean, since Tony has taken it and it has worked for Tony, it doesn't mean
Means
that
that it
when
will
I
work
take the
for
same,
you.
it
But
will work
doctor,
for-
I know the medicine. They take it from herbs. You know.
Yeah, so that's what I'm saying. Most of them
Because
So
are
what shows
extracted
herbs
from
won't
there.
work? The
No,
right
because
herbs will work.
it has gone through the right process.
That is it.
That is
So
it.
But the Papa
what
people
you're
are more.
taking
The Papa people,
it's
yeah.
sure and tested. So are there any particular STDs that people underestimate in terms of danger?
I think when it comes to vaginal discharges, because most often the ladies feels like when I'm having vaginal discharges, there's a common candidiasis, or what they call whites.
Yeah.
Since the vaginal discharges is white, but as I said, we have different types of bacterial infection, which also comes with vaginal discharges. So normally they have this misconception about it that, okay, so when I should get some pessaries, vaginal pessaries and insects, I'll be fine. So they turn up coming to the facility or the hospital late, when maybe the infection has migrated to
a different stage.
Yes, and then they are having some symptoms that will push them to come to the hospital.
Like what you described with the genital warts.
Yes. So, for instance, what we call PID, pelvic inflammatory disease. So when this infection starts from the vagina, you are seeing vaginal discharges, and you feel like it's just a normal candidiasis. So you take your pessaries, you insect, or you use any concoction over there, you are not seeing the same things again. They migrate into the uterus and the ureter, and they are able to go into the bladder. If not into the bladder, then they are entering into the endometrium, and then going straight into the fallopian tubes.
Oh boy!
And then the ovaries. So when they are able to penetrate into the tubes, that is what we call the pelvic inflammatory diseases. They can also cause what we call tuber blockages,
okay.
Then which can also result as an infertility.
Yes, that's one I'm concerned with.
So that the sexual transmitted disease too can cause infertility.
Yes.
Migration after staying with you for a
Blood
long time
of
without treatment
Jesus.
or without early treatment.
Wow.
Okay, so let's go to the roles government and schools play in reducing the spread. What do you think are some of the actions that these institutions can take in order to reduce these infections that are being widespread?
Yes, I know the public health, they are doing their best. Most often they visit the schools and then educate them on it, and they also teach them or educate them on how to use their condoms, the female condom and the male condom. They educate them on it, and also how to visit the hospital as soon as possible when you have any of these symptoms that we are talking about. So they are doing their best, and I feel like we can't be hosting a program and then invite most of the youth or the adolescents to join the program, and then they can also share their experiences whilst we educate the whole public on it. So I will encourage it that if the public health will go on to do the publications on this. Sometimes you see on social media and radio stations, publicity is going on, and then sometimes you feel like you are not hearing anything about it at all. So if you keep, going on with this kind of education, it will really help.
Okay, before I give you my last question, how do you treat people mentally? People that tend to, test positive, especially with HIV. It's a very sensitive one. It's a very no-go area. Like you made mention that a man was scared, saying that, oh, media, I have it, even though he hasn't tested. But thinking about the trauma alone, that, hey, if I go and test and I'm tested positive, how am I going to take this? So how do you take on such people mentally? Do you have a kind of counseling session? How do you take them through that? And then also, is society still very judgmental with people or persons living with HIV and AIDS? Okay.
So in our clinical settings, when you are diagnosed of HIV, that is the first response.
Okay.
We refer to an HIV center, a facility like a government center with a HIV center for counseling. And
is it in every facility, or they have it specially?
They have it specially at the government
hospitals. Okay.
So usually the best thing to do is to refer such a case to the government facility. You don't go about, telling the patient that you have HIV, blah, blah, blah.
Okay, there's a way you go about it.
There's a way you go about it. So if you are not trained and you don't understand it, you don't have to attempt it at all.
Okay.
So basically, because I remember I had a case from Winneba. That she came to our hospital at Kaswa. And this woman was shivering all over.
Oh, God.
And then she looks very sick, very ill. And then, so she's told me that she has tested HIV positive, but she wants to leave the area in Winneba for a different area to go for treatment. So when she came in, I decided to run my own investigations. So I didn't go ahead to do HIV only. I did some other investigations. So when the result came in, she was, having malaria parasite, which was very high. But then the HIV was negative. So I'm like, the HIV is negative, but the malaria is positive, which is very high.
Yeah.
So I called the laboratory guy to come in. Then I'm like, this woman said she has tested positive. So go and test again. He went back and then came and said, oh, it's negative. I said, okay, fine. So I told this lady that, do you know what? I'll give you medication. We treat the malaria. Then come the following week. Then we'll do another test from a different facility and then see. So the next week, the patient came in and then I couldn't recognize her.
She was okay.
She was looking good, nice. And I'm like, so she has to remind me that, okay, she was the patient that came the last time that she said, oh, wow, really? Then I sent the sample out again. We did the test and it was negative.
Oh.
So
So
how
after
do those
all
tests
the
happen? I don't understand. How do they make
Qualify
That is
such a
what I'm
mistake?
saying, that with the first response, you don't have to, diagnose the person or go ahead
And say
and
it.
say it. Just refer the person to appropriate place
Time to do
for
proper
testing and then
Proper
counseling.
test. Yeah.
That is the best way to go about this.
Wow.
Doc, will be my last question for you. Then we wrap up for today. What will be that one clear advice you would want to give viewers out there and listeners about how to protect themselves today?
Yep.
Looking at the rise of these bacteria, like you're saying, that they are birthing new ones each and every time. Please tell them one clear thing that they can do to protect them, especially the youth of today.
Okay, so my advice to the youth is that mostly we often find ourselves smoking, drinking alcohol, and then we have ladies with us. When you are that high, you don't think about any protection. You go in for raw sex, and that is where you are prone to all this kind of infection. We are aware of the usage of condoms, and then also I would say the usage of condom is the main source protective measure, because when we talk about abstinence is the best, but it doesn't work these days. It's difficult for people to abstain. So if you can't abstain and then you are going in for raw sex, that is dangerous. So try to protect yourself. We have the female condom and then we have the male condom as well. And so very often when you are too high with your tramadol, you are too high with your red, and then alcohol, and then the weed and all those things, it doesn't come in mind that you need to put in yourself. Condom
they
before
think
you
that
have sex.
is protection.
Yeah.
The red will protect
they
you.
just go in straight away, and then
So Doc, is there no medication that one can take before sex, even if the person is sexually transmitted or is having a sexual transmitted disease or even having HIV, that you take, that even if you do it with a person, it will prevent it?
Okay. So we don't have any prophylaxis like that. You don't have any prophylaxis unless maybe you assume that this lady, you don't trust the lady, then you can visit the facility to test yourself and then you'll be treated.
And then again, how often should one test? If you're in a relationship or you are even married, how often? Within a year, is it quarterly? Or how often should one visit the health center?
Quarterly, you should be able to
test.
Since, we are all not faithful these days.
Things are shaking. Heads are shaking.
Yeah.
Women
are cheating. Men are cheating.
I'm telling you.
I have one more question that I want to ask about this thing. If one is infected with HIV, how many years does it take to drain the person to that ACE?
Okay, so the HIV itself, as a virus, before you get into the ACE, takes a lot of years for the viral load to go high. Yes, so it normally comes out for you to have these symptoms when the immune system has started shutting down before you start having all these ACE symptoms. So it takes time, and the incubation period cannot be same for everyone.
Right, Amankwa. Do you have anything to add on?
There is one
And then
disease
you
they
end
don't
it
talk
with us.
about.
Exactly.
We call it pubic lice. Yes, doctor knows. It's an STD.
Quite tell us about it.
See, you know lice.
Adrie.
Yes.
Mm-hmm.
You can Google it on your phone. You see that is an STD.
Yeah.
You see, lice will be on your pubic.
Area.
Yes.
In this day and age.
That will be. You said what?
In this day and age.
It's part
You
of
can
us.
see them or they are
No,
invisible?
unless
Just
you
to
use
say that-
microscope. He knows that thing.
okay, I
So
know
that
what you're
place
saying.
will be itching you. You'll be doing it. You won't know. You go and sleep with someone. The lice will crawl, enter its own. So you'll be there. I'm telling you a secret. You'll be doing this. It's not a joke, Odata.
No, it's serious.
It's a sexually transmitted disease.
behaving like a
It's
grandpa.
part of the
People,
STI.
yes, people don't talk about.
It's
Yes.
part of the
You see,
STI.
it is underrated, but it is calling problems.
So it's there today.
Yeah.
You think it's that?
So
Is
that
it
one
still
too,
there?
Well,
How do you
It's
how do you
red.
clear those
Yeah.
animals from your?
You
That's
would
why-
think it's
Yeah.
gono because it will be itching.
Uh,
You might think, what is syphilis or gono?
yeah, fungi can also cause that.
You be
Fungal
doing-
infection
Amankwa, you
can
are
also cause that. So
exaggerating this
that-
thing. Let the
you,
doctor explain.
you were talking, you didn't talk about that one. That one is very important because you'll be thinking a lot of things that you might be having a lot of things. So you sleep with someone, it will go, you do this.
But doctor just said that there's another fungal.
Doctor, you know,
Yeah.
Infection.
HIV is
Yeah.
it killed 40 million people in 1980s and 90s. When you didn't get those drugs to
The antiretroviral
Yes.
drugs.
it killed a lot of people. Do you know why?
No.
The AIDS virus mutates and
Yeah.
dane.
Yeah.
It can come as a
They are
woman,
like
next time a man.
shapeshifters.
So you do the vaccination, the medicine for it. It will come
Yeah,
back
but
into
some
change.
Yeah.
That is the thing. So
But even some bacteria that cause the chlamydia and the white and all of that also do change in
Yeah.
sizes
Changes.
and
because
Mutate.
doctor
And
knows
So-
that a viral infection doesn't have a cure.
The viral
course.
infection, the reasons why
they don't have cure.
they don't have cure is that they enters into the cells of
Okay.
a human being. So if you are destroying
Very
the
dangerous.
virus, then you
That
are
means you are
destroying the
destroying the
cells.
Yes.
Oh God.
Ah.
That's what makes it difficult.
That's
Difficult,
dangerous.
yes.
That is that's the white blood cells. Bloody hell.
So talk about that one too. It's causing problems.
The lies
Amaka
one.
actually wants you to talk about it. So I think
as with the
maybe
lies,
he has
it's-
issue with
it's
that
not,
one.
It's not common now. You see, because
It's not common.
yeah,
yeah, because me I know it's not common.
It's
It's,
not common now.
it's something that was
Yeah.
there
They
before,
think
but
it's
now
gono-
yeah.
They think it's gono, but
I
it
knew
is
how-
common.
you
It's
see,
lies.
Oh, and then there's advanced
Don't you
drugs
see people
and all of
doing
that.
this?
yeah, those ones as I'm saying can be a fungal infection.
Exactly.
Yeah, it can also
Yes.
be a fungal
Eh.
infection. Okay.
So I mean, so
Yeah.
Tony, your last words, and then
All right. So, I mean, this have been a very beautiful conversation. First of all, I was so into this conversation because there have been a lot of our new, Gen Z people that don't really know much about these sexual transmitted diseases, and they don't even know how it works. You understand? So we having this conversation is very, very important. And again, to the Gen Zs that are watching me, if you are 2000 and 1990 and 1998, you should pay attention and listen. One, if you start smelling any foul odor there in the private area, trust me, it is not because you didn't bath.
drum rolls.
I'm being honest.
Is that because you didn't bath well?
Some people will think it's because they didn't bath.
As in they didn't wash their well.
Yes, but it is not that. The natural scent for somebody who didn't bath, it's not like that. It got nothing to do with that. If you smell any foul scent, like fish kind of
Fishy
style or
smell,
some,
bad,
Well, it's
offensive
Please.
odors.
please, the first thing you need to do, don't go anywhere. Don't even say you are going to see a herbalist. I'm not saying herbalist people are not good.
Doctor said it. So
Or
I mean,
any herbal, whatever. Just first go to the hospital, do a checkup, find out what actually is causing that. It can be chlamydia, it can be gonorrhea, it can be syphilis. You see, and all these diseases, they have similar what do you call it? Yes, symptoms. So if you don't take care, you'll be treating gonorrhea, but you actually having chlamydia.
Yeah.
So if you are, having all these things, please go to the hospital, run a checkup. Don't be scared. Okay, don't be scared. The worst that can happen is you being diagnosed that you are infected with that thing, and then you get a cure. But if you don't do it, that means you are keeping it, which can actually, it can actually grow and become something you cannot cure. You understand? I once went to a hospital. I was having a serious stomach pains. I don't know what happened that time. So on my bed, that was 2014 there. I was on my bed in the middle of the night around 2 to 3 a.m. I woke up and I saw this girl that was beside my bed. She was crying. So I was curious and I was like, what's up? Did your mom die or anything?
Something happened.
And she said, no, her mom is not dead. And I was like, then why are you crying? Then she said, well, she's a student, because she looked like somebody who is very young. She's young. And she said she's a student. So she had been sick for some time. She came to the hospital and they are running tests on her because they don't know what is really wrong with her due to all the symptoms she's giving them. The doctors need to run tests, and HIV was part of them. Now, her biggest problem is she's scared the HIV one will be positive. And the reason why she's scared the HIV one will be positive is she says she have been having unprotected sex for a while now, and she have been very selfish. She have been doing so many bad things that she herself, she can tell that it's HIV. And according to her, the symptoms she's even having, she have been going on Google and she have been reading from books and stuff like that, and she know very well that it's HIV, and she don't want to know that she's having HIV. So her problem is she know very well they are coming to tell her death sentence, and she don't want to hear it. So that is her biggest problem. She don't know how to tell her mom. So I was like, wait, so you don't even know your results and you're crying? She said, yes, but I know I'm having HIV.
What if it's not?
That is where the problem comes. So in the morning, I was going and I checked there and she was not there. So I asked the doctor, there was a lady, there's a young lady here. So what happened to her? And the doctor was like, oh, yeah. She, doctors, they wouldn't like to tell you what actually happened to somebody. So he was like, oh, she was sick, but I think we allowed her. She's even downstairs, so if you go, you can see her. So, okay. So as I was going, I saw her with, I think, some of her classmates. She was a little bit happy. So I called her, I say, so how did it go? Are you okay now? Say, yeah. It wasn't even HIV that I was thinking. It was actually she mentioned some weird disease. And I was like, oh, okay. And I was like, so do you understand? Do you actually understand what happened?
But you don't expect her to tell you if it's AIDS.
No, it wasn't.
Well,
if it was, from how she was behaving when we were there, I'm telling you, that girl would have killed herself. Because according to how she was speaking, she was even planning on doing that.
If it is AIDS.
Yes. Oh, I used that to write my first movie. That was Conscience. That movie was Conscience. The movie talks about a girl who was thinking she had HIV, and she started, trying. Yeah, in her mind, she's thinking a lot of things. She wanna kill herself. She even
in actual sense.
At the end round, she killed herself, and the results came and she was not even HIV positive. You understand? So, guys, I'm begging you in the name of God. Okay, there is no sickness in this world that doesn't have a cure.
Yeah,
HIV does have a cure, but
it's not true.
But it is not a cure you will find. But it's something you have to do. We call it taking responsibilities. Like you have to change your diet. You have to take care of your health. These are very important.
A whole lot of.
And yes, there's a whole lot of. Doc will tell you about it.
Yeah.
I mean, you can have HIV, but you can live long if you're taking care of yourself, right?
If you take that drugs, you live.
That is what I'm saying. So don't say because we are saying if you take drugs, you live long, bro. Even if you get it right now, your mindset will even kill you before you die. So don't go and get it.
Don't go and get it. That's what he's saying. Doc, would you want to add on anything? Your final words? Tell people where to find you.
Yeah.
And then you leave your contact.
What you do, the machines and all that.
Okay, so Minutes Medical and Fertility Hospital is the hospital I work with.
Okay.
Then we are located at Kukrubite in Kaswa area.
Yeah.
And also Amasama Fisi.
Okay.
Yeah, so basically we do medical cases and then ups and gyne cases as well. So we do delivery and all those cases. We also do IVF and IUI as well.
Okay.
And then we also have a surrogacy home as well.
Okay. That's interesting. Those that want people to carry their children for them, you're welcome. Doc has opened his arms wide open. You can walk in and then have a consultation with him. And then we see how things go. It's been an interesting episode today. Today is so enlightening. I want to go deeper. We might have Doc here again because we didn't touch on most things. Exactly. Treatments and the cure and what have you, possibilities of you even not getting infected at all. So we'll go into it next time Doc comes around. STDs don't just spread. Ignorance do. So please, let's take it upon ourselves. Be reminded that if you are in your 30s or from mid-20s to late 20s, hitting your 30s, please, as a woman, don't forget your pap smear. It should be one of the vital things you carry around as your handbag. It should be very important to you. It will save you a lot of stress in this day and age that, the usage of sex toys, dildos, and all of that are being used commonly. Girl to girl, boy to boy. This is a brother to sister and a sister to sister, advice. So please, let's help ourselves so that we can have a better place for our next generation. Where we are heading to, no, I know your shit. Please, we might take your break, kakra.
Swear.
Kakra.
Yeah.
We are pamucho. Dr. Kra was shocked. Vibration from 1 to 5. No shit. Doctor is even shocked. Yeah, is doing the reaction at the back there. So please, we'll see you same time next week. Don't forget, share, subscribe, and send in your reservations. This has been the Real Talk Podcast Show. My name is Liz. I'll come your way same time next week.